This video is going to be working through an example of an acupuncture treatment protocol for stifle pain. We're going to assume that this is a unilateral chronic issue in Maverick here. We'll work on the right leg. So going with the main protocol, we're going to start with our central nervous system points, although we don't have to start there, but they're a consideration. I chose GB4 and bladder 25. So GB4 is dorsal midline, just caudal to the spinous processes of L2. So we know that if we go from the last rib and follow it directly dorsal to midline, that's going to be our intersection of L2 and L3. So for the bladder line, we would go more laterally, but with the governing vessel, it'll be right on dorsal midline there. And the second one's bladder 25. So bladder 25 is going to be just lateral to and the caudolateral aspect of the spinous process of L5 between longissimus and iliocostalis. So we have L2, the L2-3 junction there. So we're going to want to palpate L3, L4, L4, L5, L5, L6, palpate for the spinous process, and then we're going to go lateral and caudal to that point in the groove between those two epaxial muscles there. Moving on to the peripheral nervous system points, I chose spleen 9 as one of them. So again, spleen 9 is going to be just sort of distal to the medial tibial condyle in a well palpated groove. And it's a powerful point for its attachment of multiple different muscles and their different associated nerves. And it is a local point for the stifle. I also chose stomach 34 to have a more sort of cranial point. Stomach 34 is in the body of the vastus lateralis muscle. So again, I would be palpating for the stifle and following it up to feel sort of vastus medialis, rectus femoris, vastus lateralis, and in a rather muscular region at the distal aspect is where we're going to have our stomach 34. I also chose a lateral stifle point, so GB31. This is on the lateral aspect of the stifle in the biceps femoris muscle, in a depression that's caudal to the femur and just proximal to the joint line. So I would be able to find, again, joint line by doing some flexion and extension. But if we're estimating it to be about here and we're looking at that biceps femoris muscle here, we would be going just proximal and then looking for kind of a depression off of the femur. That's going to be our GB 31. There we go. The final point I chose was a more distal point, bladder 60. So bladder 60 is going to be just proximal to the lateral malleolus in sort of the groove between the calcaneal tendon and the associated tibia and fibula. And so by palpating for lateral malleolus, I can sink into a nice groove right here, and that's going to be our bladder 60. Autonomic nervous system points, I chose Boway and stomach 36. So for Boway, that's going to be at our lumbosacral junction. So if we remember, we had bladder 25, which is going to be at the level between L5 and L6. Once I feel that groove on dorsal midline, I can follow it backwards to get L6, L7, and then L7, S1. Dorsal midline, Boway, really good autonomic parasympathetic point there. And then stomach 36, although I wouldn't expect to necessarily be able to get all these points in an actual patient, and especially stomach 36 because it can be a more tender point, It's in the muscle of the cranialis tibialis muscle. And so we're kind of encircling the stifle here with our spleen 9 and our stomach 34. Stomach 36 would be distal to both of those points on sort of the craniolateral aspect. And the final sort of stifle point, if you're looking at just circling it from kind of a cranial perspective, would be our spleen 10 in vastus medialis, but I didn't include that here. Finally, 2 myofascial points to consider, although this would depend on the palpation of the patient. I thought maybe a bladder 40, so that's in the center of the popliteus on the caudal aspect of the stifle. Also a nice way to just kind of ensure that I have, I'm kind of encircling the stifle and not just focusing on cranial or medial aspects if we're concerned about, say, a chronic cruciate or things that are less commonly recognized in stifle in terms of dysfunction. And then, yeah, so our bladder 54, palpating for greater trochanter of the femur and looking to go just dorsal to that greater trochanter there. There we go. If I were to include e-stim, so I don't have an electroacupuncture machine yet, but I figured if this is a chronic injury, maybe we're wanting to just provide a bit longer term analgesia, so I would maybe set this at a 2 to 10 hertz range for that. And I thought a nice combination would be going from our bladder 25 point to our spleen 9 point. It's just falling down here, but kind of just to span above and below and use 2 rather powerful points there. So that's an example of a case.